The following portion of Bloom is sponsored by Health and Psychiatry.
Welcome back to Bloom. A new survey out shows Americans are becoming more open about mental health, and experts say that's a good thing. Today, we are honored to have Dr. Dinar Sajan in studio with us, the Chief Medical Officer from Health and Psychiatry, one of Florida's largest mental wellness providers. She's here to educate us about a common mental disorder. Dr. Sajan, welcome to Bloom.
Well, thank you.
Dr. Sajan, I know you completed your psychiatry residency at Northwestern Memorial Hospital in Chicago, one of the top psychiatry programs really in the world, and now finally, we're starting to talk more openly about mental health. That must make you feel so good.
Yes, it does. We have seen way more awareness now. People are more open to talk about it. The social media has provided us many platforms, and that has made people more easily able to talk about it and get the help that they need.
But we are starting to see a rise in something called anxiety disorders. A lot of patients are dealing with that.
Yes, we live in a very fast-paced, competitive world, and we go through so many challenges in our everyday life, from academic challenges, work challenges, to life relationships, financial stresses. And on top of that, the pandemic has caused so much loneliness, isolation, so much anxiety in a lot of people. People have lost their loved ones, they've gone through financial crisis. So all that put together, we have definitely seen a rise.
So what types of anxieties are you seeing, and what are some of the symptoms that people should be on the lookout for?
So anxiety is an umbrella term for many different symptoms and disorders. We all have what we call healthy anxiety that helps us get through our everyday challenges in life. It's when the anxiety gets to the point that it's interfering with our well-being, that's when it becomes troublesome. Symptoms can vary from having specific phobias to having irrational fears that takes over our lives, to having panic attacks where people feel like they are lightheaded, difficulty breathing, their heart is pounding. At times they end up in the ER thinking they're having a heart attack or they're about to die. So when anxiety gets to the point where it is preventing us from leading a happy, productive life, it's taking over our lives, that's when we need to get some help.
Well, Dr. Sajan, I know we're very lucky to have a provider like you right here in the Tampa Bay area. How do you personally treat your patients?
So treatments can be like in many different ways, from medication management to different kinds of therapy to lifestyle modification. It really depends on individual people. Most of the time it is individualized treatment plans that we do.
That's wonderful. Tell me a little bit about your office.
So my office is located in Oldsmar. It's easily accessible from many cities. My goal has been to have a very peaceful, serene atmosphere, and I've tried to achieve that.
Well, that is really wonderful. Once again, we're so lucky to have you right here in the Tampa Bay area. I know you come with vast knowledge, and the way you care for your patients is very much respected. So thank you for coming on Bloom today.
Well, thank you for having me.
Absolutely. And if you're interested in learning more about taking care of your mental health, go to healthandpsychiatry.com or call them at 833-377-2526. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Health and Psychiatry.